The care of the patients is so interesting, it's so unique. You get a really varied workload. You could have a patient on ECMO and inotropes. They might have an open chest still from surgery, or you might have a patient, they're on a ventilator, we're weaning them off, and they need a lot more emotional support, reassurance and input from the wider team. And this team in general is just really, really welcoming, really supportive. Everyone helps each other out, and it's just a really nice place to work.
We do all sorts of cardiothoracic surgeries. We do bypasses and valve repairs and replacements. And we do a lot of heart transplants, lung transplants, and we also do mechanical devices. As you work here, you'll learn about a lot of the equipment that we use. So you can see the ventilator at the back there. You can see a whole range of infusions. And then this here is a VAD, which we normally use as a bridge to a transplant or as a destination therapy for our heart failure patients.
So that's your left ventricular assist device, which is connected through a drive line directly into the patient, and the machine sits in their left ventricle and pumps the blood around their body. Everything that we do is done on our ICIP computers, so that's all of the stuff that you would normally see on paper on the wards. It's just the equivalent on the computers. We've got the Omnicell, which is where we store all our drugs, so that will keep a track of the stock as we take things out. So hopefully we're not going to run out of any meds or anything like that, and the pharmacy knows exactly what we've got. If a patient is tubed, you've obviously got your ventilator. So we have many patients either with ET tubes, tracheostomies, or on various methods of NIV. That is the hemofilter, so we use that for the filtration of patients, whether that's for fluid offloading or toxin removal.
Looking after extremely complex patients has given me a great in-depth into cardiac and surgical care. The ECMO is one of the most important machines for cardiac care. ECMO stands for extracorporeal membrane oxygenator. The ECMO basically takes over the heart function or the lung function of the patients, or both. We drain the blood from the patients using a large femoral or jugular vein. The blood goes into this access line. It oxygenates the patient's blood, and it gets rid of the carbon dioxide of the patient. And then when this blood is oxygenated, it goes back into a patient's artery or patient's vein.
We are actually doing a rotation. We are working between recovery and ITU. We are taking thoracic patients and cardiac patients. We make sure that everything is stable. We're doing every 15 minutes observations. We're checking the output, make sure the patient is not bleeding. We will doing a very close monitoring of the vital signs and also the drain output. So if everything is okay, we are aiming to extubate and then discharge them to high dependency unit.
Because in ITU it is a one-to-one nurse-to-patient ratio, you do get to know your patients really well. And it's so lovely to see their progressive journey throughout their stay on ITU. Before they go home, they walk onto the unit to come and wave goodbye to us, and it's almost like you're seeing a completely different person. We have lots of career opportunities working at Harefield ITU. You'll obviously gain all of your critical care skills and get all your competencies signed off. Along with that, you'll be able to be a part of the academic programme, which is run by our practice development team, where you get to learn about all the different therapies and all the different things that we do on ITU. And you'll be able to apply for the postgrad intensive care course at university. The other things that we offer are different secondments with our critical care outreach team and with the practice development team as well. I've really enjoyed working here for the last 6 years, and I couldn't imagine working anywhere else.